I'm here to talk to you about Barrett's esophagus. The esophagus is a hollow tube that connects the mouth to the stomach and transmits all of the food that we eat every day. The lining of the esophagus is very similar to your skin, and when it's healthy, that's how it should stay. But in some people who have chronic heartburn or reflux without heartburn, that is the passage of contents from the stomach up into the esophagus, that lining can change. When it becomes very much like the intestine, in fact we call it intestinal metaplasia, then that's not such a good thing to happen. And some patients will develop a condition called Barrett's esophagus, where that intestinal metaplasia becomes permanent. Why is that important? Because in some of those patients there is a cancer risk developing from that lining, and unfortunately in the world cancer of the esophagus is on the increase, not the decrease, like many of the other cancers that we treat and prevent. The problem for us as gastroenterologists is being able to identify those people who have Barrett's esophagus, because we want to try to not only identify it, but prevent it getting worse. And we can do that by examining the cells that line the esophagus that create the Barrett's, because those changes that take place ahead of cancer, so-called precancerous changes, can be identified. The first thing usually is that the patient has an endoscopy for whatever reasons, dyspepsia, reflux, or other reasons, and Barrett's esophagus may be suspected. The traditional way of diagnosing Barrett's esophagus is by a biopsy, that is the obtaining of tissue samples from the lining by taking small pieces with forceps. And that has an intrinsic inaccuracy because one is taking a very small sample of quite a large area. And we have not been happy with this for a very long time, but that has been the standard method until now. Now we have other methods that help us make that diagnosis more accurate. We have different ways of looking at the tissue with different wavelengths of light, but most recently we have been able to examine the tissue at a microscopic level during the endoscopy. The Cellvizio brand allows us to, using a probe down the endoscope, to look at this tissue or interrogate it during the real-time endoscopy. And that's been a tremendous help to us because it's the most accurate method we have for diagnosing Barrett's esophagus when it's there. And we use this now routinely in patients with Barrett's esophagus, not only to confirm the diagnosis, but to identify those precancerous changes known as dysplasia. And this guides not only our biopsies, but also the treatment that we can offer at the same time.